Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and today we are going to be talking about recovery during the holidays. Joining me is Mara Johnson. She's the Recovery Navigator Coordinator. We also have Andy Matthews, who's a Recovery Coordinator, and Tori Hutchison, who's also a Recovery Coordinator. How are y'all today?
Good.
Doing good today. Thank you.
Awesome. Thanks for coming in. So like I said, we're going to talk about recovery during the holidays. Can you guys shed a light about what that might mean?
So all three of us are people in long-term recovery from some sort of substance use disorder. And so I think we would all agree that during the holidays, it's a little bit harder for people in recovery. There are a lot of challenges that are specific to us to overcome, and especially with COVID going on right now, that's kind of a double whammy.
I'm sure.
So we wanted to talk a little bit about how that looks for us and how to support your family members if they are in recovery.
Yeah, that's great. I guess I'll just ask from a personal standpoint, like how difficult are the holidays for you guys, or for people that you know who have been through situations that you have?
What was the experience like for you in early recovery, maybe?
My experience being in recovery, just going home for the holidays, being around family members that, drink alcohol around the holidays, or some, that I even was in an active addiction with, being able to be in the same room with them and just not get wrapped up in their problems.
Sure.
It was difficult. But I made it through, and I continue to do so just by talking to my sponsor and just venting to her and, being grateful that I'm not in that situation anymore. I'm not that person. I'm on the other side of it. So
congratulations for that, by the way.
Thank you.
That's amazing. Andy, what about you?
Well, for the holidays for me around our house, going to grandma's house and visiting family, there was always a lot of alcohol and drugs involved with me and my cousins. When I got into early recovery, choosing not to go outside with them when they were outside, it was pretty difficult because I saw what they were doing and I knew what they were doing, but yet surrounding myself with some positive members of our family really made a big difference. And just knowing what I wanted, that I wanted to be there with my family and I wanted to be there sober, and I wanted to be able to enjoy time with my family instead of what I'd always done in the past.
Yeah, that's great. Mara, what about you?
Well, I learned really quick in early recovery with family gatherings that I needed to drive my own car. That way, if I was in an uncomfortable situation, which I found myself in a couple of times, I think my first Thanksgiving sober, I showed up and, I rode with my dad, and a lot of people were drinking. And so it was difficult for me. I felt very uncomfortable, and everybody was kind of good with hanging out, sticking around, and I was just kind of ready to go
home.
And so I learned early that I needed to go when I was ready to go.
Yeah.
And one of the other things I really utilized on holidays was my AA support system, making sure that I had a meeting on that holiday. Even if I wasn't at home to go to my home group, I would find a meeting out of town wherever I was. And I think that was really important to be able to connect to my people. What had kind of become my tribe and my people. I think that was really important for me.
That's amazing. Lots of families, they do have some sort of substance, whether it's alcohol or drugs, during the holidays, and even not during the holidays. But it's great that you guys were able to consciously choose not to partake. I love the driving yourself choice. That's really great because you have to get home at some point. And
might as well be on your own terms.
Right. Yeah, that's great. For people out there who may not have made the choice to be sober yet, but are thinking about it, they want to be, how can they be supported during the holidays?
I think right now a lot of people are struggling with a lot of things. I think people who maybe didn't have substance use issues prior to COVID, there are a lot of people that now have substance use issues.
Yeah, that makes sense.
Or maybe people that have relapsed, or people who've just continuously been using some sort of substance. I think main way to support them is to let them know that there's help out there. In the work we do inside of the emergency room, we have people that come through that are not always ready to get help. And so our role at that point becomes support. We follow up with them, we call them, we pick up when they call us.
Sure.
And when they're ready, we're going to be there for them.
I think it's really great for people to understand that as people at Pathways, they really do care about the patients that come in, mainly because you guys have been there and you understand it, you get it.
Absolutely.
You know the feelings that somebody might be having. So I think it's phenomenal that you guys are doing what you're doing. That's great.
It's also important that these people know that when they're ready, we're going to pick up the phone and that there is help out there. I remember feeling hopeless because I didn't know. I knew I wanted to get better. I knew I didn't want to live like I was living anymore, but I didn't know what to do.
Right. I think it's also important to state that the help is genuine, but it comes from a place of non-judgment.
100%.
I've never been in the situation, so correct me if I'm wrong, but I feel like a lot of people who have dealt with that may deal with feelings of, well, I'm going to show up somewhere and they're going to laugh me out of the room or they're going to judge me and not take me seriously. So I think it's great that you guys are not doing that. And I think you guys are
Absolutely. I think the
awesome
shame
stuff.
and the guilt keeps us isolated.
Sure.
Especially during holiday season. We don't want to go around our family. We want to be around our family, but we're scared and fearful and guilty because we're doing what we're doing and we don't want our families to see us like
Right.
that. I know that I experienced that myself.
Sure, I did too. And there's just, in general, a lot of stigma out there for people like us or people that's in active addiction. So our role being there when they come through the emergency department, just getting that support and saying, hey, I understand. You know, I've been exactly where you've been and there's no judgment. I know the people that we service, they really appreciate that because they get that judgment from so many other people. If that's all we do, you know, at the end of seeing a client, then that's okay. When they are ready, they're going to call one of us because they remember.
I think sometimes you just see a light come on, Will, when you tell them what a recovery navigator is. You know, that's not a fancy title for someone who's gone to school and has done all this. We are in recovery from alcohol and drug addiction, and I've been where you're sitting at right now, and no one was available then to let me know all the resources that were out there to help me. That there are people out there who truly, truly want to help you in this time. You know, the roughest time of my life was when I was in active addiction, and there's a team of people who want to help them and do nothing except see them succeed. You know, I think that is really important because for me, when in active addiction, I felt like I was alone. I had gotten myself isolated and
100%.
alone, just exactly where addiction wanted me. It wanted me alone so that it could kill me. And, you know, now that I share with people that, hey, you don't have to be alone. You don't have to have all those feelings that are inside you that are negative because you've got people that want to be on your team that want to help you. I think that's really important this time of year.
Yeah, that's amazing.
I think that's especially important this time of year and also with COVID because so many people are finding themselves isolated. Our addiction pushes us into isolation as it is, and then that gets even deeper with COVID right now. And so I think it's more so important now than ever that people are able to find that kind of support, whether it be from us through the emergency room or through Pathways for just mental health. I mean, people struggle during the holidays, not just with substance use disorders.
Right.
You know, there's a lot of depression, anxiety, there's financial troubles, especially with COVID, people losing jobs. It's just a very stressful time of year. And then you add COVID on top of that. I think the biggest thing people need to know is that there is help out there. There's judgment-free help out there.
That's
and
huge.
there is a whole team of people out there ready to love you and help you with whatever it is you may need help with.
That's amazing. And you don't really have to look farther than really your backyard.
Right here.
We're here in Jackson.
Jackson, Milan, Dyersburg, Martin, Oliver, Camden.
So really anywhere there's a West Tennessee Healthcare owned hospital, there's
Correct.
going to be Pathways there as well.
Pathways isn't at all of those locations, but you can get connected through where there's any West Tennessee Healthcare hospital. You can get connected with some sort of mental health provider.
That's amazing. So people out there listening, you're not alone. It might feel like you are, but there really are people out there who want the best for you, who understand what you've gone through and really do mean it when they say they get it and they want you to succeed. So yeah, if you guys are interested in finding out more about Pathways, there will be a link to their website in the description of this podcast. And Mara, what's the phone number if someone needs to call?
Phone number for Pathways is 731-541-8200. That's for mental health help, which could look like medications, crisis stabilization, also drug and alcohol detox. We also have medication-assisted treatment program.
Good.
And that would be Pathways.
Perfect. You're not alone. People who are out there who feel like they are, you really aren't. You don't have to continue to be in isolation. Give them a call. They can and will help you.
If you or somebody is struggling with some sort of substance use disorder and they want to talk about it, or it's a family member and you want to call us and talk about it, you're free to call a recovery navigator. Our phone number is 731-541-5485.
Perfect. Thank you guys so much, and thanks for listening to another episode of We Talk Health.